Hello, this is for my social welfare project, the final project. We had to pick a social policy and a social problem in either healthcare or criminal justice. I picked healthcare, and my video or my project I picked was about the opioid epidemic and the heroin epidemic. So why is it a social problem? The opioid epidemic is a social problem because this issue affects many people. There are over 115 overdoses in the U.S. each year. The opioid epidemic is a national crisis that affects public health, and the economic burden it causes in the U.S. equals to $78.5 billion a year. This estimate was done by the Centers for Disease Control and Prevention. So, how did this social problem arise? Well, this social problem arose in the in the late 1990s. Pharmaceutical companies reassured the medical community that patients would not become addicted to prescription opioid pain relievers, and healthcare providers began to prescribe them at greater rates. This resulted in widespread misuse of these medications before it became clear that these medications could indeed be highly addictive. Opioid overdoses rates began to increase. In 2015, more than 33,000 Americans died as a result of an opioid overdose, including prescription opioids, heroin, and fentanyl. Once these medications became harder to get, people turned to heroin for the same high because it's cheaper and easier to get than the prescription medications. So what impacts does this have on society? Well, heroin can impact the health of the individual doing the drug in so many ways. When someone takes heroin, it metabolizes back into morphine, and it can cause organ damage to the heart, liver, kidneys, and lungs. It could also lead to infectious diseases and breathing problems. In addition to the health impact on the individual, there are societal effects as well. Between 2007 and 2014, the number of people who reported using heroin tripled. It went from 161,000 to more than 435,000. Heroin is cheaper and purer than it was in the 1980s and the 90s. There isn't a typical heroin user anymore. It's become more common in the suburbs and among wealthier users. Heroin is one of the most deadly drugs, of course. More people seek treatment for addiction to heroin than any other drug, and that includes prescription medication. Let's see. Heroin deaths rose 439% between 1999 and 2014 and have gone up more than 3 times in 5 years. Healthy relationships are a key element of society, of course, and when someone is addicted to heroin, it destroys relationships and can lead to divorce and neglected and abandoned children. Someone on heroin tends to be unable to maintain honest relationships with the people around them, and they can exhibit unpredictable or dangerous behavior that diminishes relationships and families. Heroin use has also been associated with domestic violence, loss of custody of children, and financial problems that can lead families of people on heroin to experience everything from receiving financial assistance from the government to being homeless. Everyone is affected by this epidemic. Heroin and opioid use can be found in every neighborhood. So, solutions to the opioid epidemic. Some solutions consist of improving access to treatment and recovery services, promoting use of overdose reversing drugs. There's a overdose reversing drug called I forgot the name, Naxaline or something like that. Strengthening our understanding of the epidemic through better public health surveillance, providing support for cutting-edge research on pain and addiction, and advancing better practice for pain management. These costs easily could climb into the tens and thousands of dollars. By the way, the overdose reversing drug is called Narcan. That's what it's called. Social policy. This is a policy that combats opioid epidemic. A social policy that has helped to combat the opioid epidemic is Title 21 of the United States Code of the Controlled Substance Act. This act limits healthcare professionals when prescribing controlled substances. There was controversy with patients when this law was enacted. Patients who really need the pain medication suffer, and it will be harder for them to get the medication. This piece of legislation does help with the social problem because it will be harder for addicts to get their hands on this pain medication. But at the same time, it will not be fair for patients really needing this medication for pain relief. Thank you. That is my final project. Thank you for listening and watching.